Matt Hancock wanted to decide, and I quote, who should live and who should die during the COVID pandemic. That is the shocking claim from the former head of NHS England, Sir Simon Stevens, who led the health service up until 2021. He told the COVID inquiry that the former health secretary wanted to make the decisions himself rather than listen to the medical professionals.
If absolute disaster strikes, then how would you ration care, limit it in a way that would be fairest and have the, be the most defensible under this, horrible situation. But I certainly wanted to discourage the idea that an individual Secretary of State, other than in the most exceptional circumstances, should be deciding how care would be provided. I felt that we are well served by the medical profession in consultation with patients to the greatest extent possible making those kinds of decisions.
Also giving evidence to the public inquiry today was one of the top civil servants in the health department who said the government was at least a week behind at all points. Sir Christopher Wormald said lockdown measures, should have been introduced a great deal earlier.
I do understand the argument. I don't agree with them, but I understand the arguments from people that lockdowns are more damage than they do. In that case, that is made. I understand it, don't agree with it. But if you're going to have a lockdown, which we did, it would have been much better to do it earlier, in my view. I wasn't the decision taker, but in my view, than when we did in November. So I see the decision making very, very differently in that March 1st lockdown, which I say was based on uncertainty, and the second and third ones, which were based on certainty but disagreements about the right strategy.
Joining me in the studio now, Chief Political Commentator at The Independent, John Rentoul. Hello, John. Thanks for coming. We're also joined by former Conservative Minister David Mellor. Hello, David. Thank you very much indeed for joining us. And Dr. Saleyha Ahsan, an A&E doctor who lost her dad to COVID. We've already discussed it earlier in the week. Why don't we start with the doctor, since we have a doctor on the programme, and talk to you about this idea, posited today, that Matt Hancock thought it would be better were he to make the decisions about which patients in hospital were the most deserving of a prolonged life and which were not.
Disgusting, really. There's no other way to put it. The audacity to think that he would somehow have the ability and the position to triage who lives and who dies in an extreme situation. Other countries didn't have, well, China, other countries across Europe who were faring pretty terribly before COVID hit our shores. I don't believe that that was an opinion that was raised by any of their equivalents at that point. The more I hear about Matt Hancock, the more I shudder to think that that man was the Secretary of State of Health during a once-in-a-lifetime pandemic. I really hope that this is the last that we see of him following this. How can you show your face in public now?
As a doctor who has taken, as all doctors have to, the Hippocratic Oath, and I might add, don't have to, they are privileged to, they want to take it. Can you conceive of a situation where either Matt Hancock or somebody else was telling you as doctors, all right, you're going to have to terminate various lives early, you're going to have to refrain from prolonging others, you're going to have to decide each ward by ward which patient should live and which should die, who should deserve the gift of longer life and who should not? Could you imagine anyone asking you to do that? And if they had done so, could you imagine obeying that edict?
So, Vanessa, I work in austere settings, in conflict settings as a doctor. I have worked, I'm an ex-military army officer prior to being a doctor within the medical setting. We worked in really, really challenging places, and I have worked in very challenging places where there have been numbers of casualties and very, very sick people coming in. And I am constantly training in this space. Never has that, in any of the protocols, guidelines, or lessons that we are learning or training in this space, never has there been written that when it becomes really, really difficult, those decisions will fall to the Secretary of the State of the country. Never. And the fact that he imposed himself on a potential guideline in that way, I think is just staggering. I can't imagine what the chief medical officer must have thought when he heard that. It would definitely be something categorically I would have refused to have gone by, and I would have faced whatever. It was something that is just inconceivable to have followed.
Thank you. Let me bring David Mellor into the conversation. David, thank you for joining us this afternoon. You presided over the government's, in your day, huge and very pressing and worrying problem, which was the problem of HIV, how to stop the spread, what to do about communicating vital information to a public who didn't really understand what was going on. So you have a unique insight into an unprecedented situation, a situation where nobody really knows quite what to do. But I believe you approached it in an entirely different way. So I'm wondering how you're responding to these COVID inquiry revelations.
I'm deeply shocked, actually. Deeply shocked at the awful descriptions of what number 10 was like under Boris Johnson. I thought I was beyond being shocked by the activities of the former health secretary, but I'm afraid, he always beats any scepticism one might have by behaving even worse than one had ever imagined. You see, when we were dealing with HIV, nobody really knew whether AIDS was going to become an epidemic or a pandemic. What we tried to do was, first of all, to be as candid with the public as we could, and secondly, to try and make sure that people understood that the government wanted to do the right thing, and the government approached this issue purely on the evidence and didn't have a lot of advisors falling out with each other in public and giving the impression that the government was a shambles. And I don't think our response, I hope this doesn't sound too self-serving, did make the government look a shambles. And indeed, while all this stuff is going on with this evidence, we're just coming to the end of an inquiry that I gave evidence to, as did a number of other leading ministers of the time, which was about where we felt the truth lay in what about this pandemic and how we tried to tackle it. And I am deeply shocked. Look, I gave evidence to that inquiry, and it was very touching because, we were dealing here with people who had been infected with AIDS by blood products that had been bought from the United States on the commercial market. And no one knew then that the effect of that was that some blood products would give you AIDS rather than cure you of the consequences of not having blood that would clot.
Yes, haemophilia.
And I gave evidence, and it was very moving to give evidence of that. But I felt that we were reaching out to each other, and it was really, I stayed on after the evidence session and talked to people whose families had suffered terribly in all of this. It surely isn't necessary to have a totally shambolic gang of people like Matt Hancock making a total mess of it. And I hope this doesn't sound smug and self-serving. I'm not trying to be either. But the reason why this inquiry, the inquiry into infected blood, isn't making the headlines is because people are working quietly and purposefully, trying to get to the bottom of these issues. And everybody is doing so in a good spirit. I don't see how anyone can be in a good spirit when dealing with Hancock. And of course, the other thing you've got to bear in mind is that the descriptions of number 10 under Boris Johnson are so awful. I bury my head in my hands sometimes and even shed the odd tear, because this is a government from a party that I believed in, that I served for many years, and I'm thinking, what the hell was going on?
David Mellor, if people are listening or watching to this programme now and they're thinking, well, I imagine it would have been the same were any government at the helm. You know, people would have been scrabbling around, some people would have been egomaniacs, others would have been vacillators, some would have listened to the science, some would have wanted to overrule it. There would have been a catastrophic, kind of absurd atmosphere, whichever government prevailed at the time. Would you be able to say, actually, that's not true? And having been in government, not all governments would operate in that kind of catastrophic manner.
Well, we didn't. You know, you cast your mind back to what happened with AIDS. People didn't know what they were dealing with, how AIDS was spread, where AIDS was going to end up. Was it going to be an unpleasant epidemic for some people, or did it have the potential to be a pandemic? And what happened there was serious efforts were made by serious people, led largely by Lord Fowler, Norman Fowler. And what we tried to do was to give people an opportunity to change some habits that were going to cause them grave risks, and to reach out to communities that, you know, you think a child is given an infected blood product and ends up being infected with AIDS. It's unimaginably awful. And yet somehow or other, this inquiry has proceeded with people having respect for each other. And, you know, people were not trying to say, you did this, you did that. There was no hostility, because nobody, I think, really felt that anybody was actually behaving like clowns.
Let me bring John Rentoul into the picture, because he's from a very different political persuasion, different kind of perspective. What are you seeing and hearing from this extraordinary inquiry into COVID?
Well, I was at the inquiry this week, and it is extraordinary. I mean, I personally think it's a waste of time and money, because I think I very much get the impression that Baroness Hallett has already made up her mind about what her conclusions are going to be, and they're in line with what everyone thinks. And people use these inquiries to try to put politicians in the stocks. And in Boris Johnson's case, I'm afraid, you know, he's his own worst enemy. He clearly did run a rather dysfunctional administration. But I think you were sort of hinting at a point there, Vanessa, which is that in an era of WhatsApps and emails, you know, I mean, the sorts of swear words and sort of bad language and people expressing frustration, which would normally just be in normal conversation face to face, and there'd be no record of it. All of that has been exposed in writing this time, and that makes it look 10 times worse.
Let's bring Dr. Ahsan back into this. We've already spoken on this programme earlier in the week, Doctor, and of course one of the, the moving factors of your participation on the programme is that you lost your own father to COVID. And when you hear John Rentoul say, well, you know, emails and, you know, it's all that down there, all the swear words, all the nastiness, all the backbiting and infighting is there, it wouldn't normally be there. I'm wondering whether you're thinking that really is the least of it, that is the least of these revelations, really. The language is one thing, the on the hoof, ludicrous kind of, you know, vacillating is not the main point here. What are you learning that you may not have known but suspected before, perhaps?
Yeah, absolutely. And I don't think this is a waste of time and a waste of money. I think this is an exceptionally important exercise because, yes, the pandemic might have been once in our lifetime. Who knows? Within the areas of medicine that I practice and study, we are always preparing for the next one. We call it disease X. I'm not scaremongering, but we are always preparing. And important lessons that we are learning now must never be repeated. And I hope that this is setting an example and a warning to future governments that when there is a time of crisis, again, that the eye will be on you and that these things do come out. We are learning really important things right now. For me, as a doctor who's working on the front line within, and my colleagues, working within different parts of the hospital, dealing with COVID patients, and then also having to deal with ludicrous decisions that were coming out. For example, not to test care home residents before they were discharged back into their care homes from hospital. We could not work out where that instruction and who came up with that idea, thinking that was a sensible thing. So unpicking where those decisions came from, who made them and why is really crucial, because that is where the lessons will be learned. This is not a waste. This is important and crucial. And more importantly, I am hoping that it leads to something further down the line, including prosecutions.
Let me bring David Mellor in. Do you think there's a likelihood of prosecutions? And if you think any lessons so far have been learned, what are they?
Well, I think one of the lessons that's been learned is that some people should never be in government ever again and shouldn't have had the opportunity to be in government the first time. The lesson that I learned from this is it didn't have to be like that, and that it's perfectly possible to create an environment within which you are tackling an unknown threat, and AIDS was really an unknown threat at that time. We didn't know where the AIDS, whether it was going to be a pandemic, maybe an epidemic, whether it's only going to affect a section of this community, whether it was going to sweep through a whole lot of people who mercifully never got it. But it's to create a working environment in which people were trying to tease out these issues in a proper form. What I found horrified by, and by the way, I can swear as well as anybody, and I consider myself quite an expert at swearing. But I looked through all the things that I had done during this AIDS epidemic. And I thought to myself, well, those notes that I made actually represented a me that I didn't mind the public seeing. I mean, how do you feel if you're Boris Johnson? I mean, Boris Johnson's got a thick skin. And Hancock, well, there isn't any word the human language has yet invented that can really describe Hancock. But what do they think as they look at all this stuff? I mean, do they feel any sense of shame? They should feel ashamed of a lot of this stuff.